Senator put me in charge of the weather, and I let him down.
Gary, you never. Whoa.
Always sunny in 70. It's connected.
Always sunny in 70 somewhere.
Hey, you know Cincinnati?
Sunny in Philadelphia. That's for sure.
Funny to say.
Okay. Good afternoon, everyone, and thank you for coming. Here in the Capital Region, we're joined by a lot of people who are very helpful in healthcare. Joe Gambino is CEO of Hometown Health Centers. You'll see him in a minute. You'll hear from him in a bit. Bill Fabian, he's chairman of the board of Hometown Health. Bill? Thank you. Thank you.
Pause a second, please.
What?
We got the fire truck.
We have David Shippey, CEO of Whitney Young Health Centers in Albany. There's David. Pam Fisher, who I met with in Washington last week. I met with 20 leaders of CHCs, of community health centers, last week. Pam is Director of External Affairs at Hudson Headwaters, which serves Grand Falls and Adirondack Park. I saved them, how many years ago, Pam? About 15 years ago. We got them the money they needed to serve the rural people up there. We have our great mayor of Schenectady, Gary McCarthy, and our great chair of the legislature, Gary Hughes. Okay. Let me give you these, Steve, or somebody. It's all going to blow away. So, why are we here? Well, 2 weeks ago, Donald Trump's funding freeze caused a shockwave of chaos and confusion in nearly every corner of America. Nonprofits from one end of New York to the other had their funds frozen and were scared to death. It's not just community health centers. I'll get to that in a minute. It was Head Start programs. We had 200 people just had no Head Start. It was veterans organizations. It was mental health organizations. It was local organizations and community organizations. Illegally, they just said, we're cutting off your funding. And right now, our community health centers are in the middle of this chaos. They're in the crossfire right now. Despite the administration, Trump said Medicaid would be exempt from the funding freeze, and then automatically the payment system in HHS just shut down. It's happened multiple times in the past 2 weeks, and we don't have any answers. We don't have any answers as to why. It's back online now, but we're hearing from healthcare centers across New York State, that their funding is intermittent. They go on and offline again and again and again. When these folks had their funding shut off, they were just so upset and frightened for good reason. Should they lay off staff? Should they not give a 2-week health care plan to someone who came in because they might not have funding next week? What do they do if they don't have money for the rent? Our community health centers depend on federal funding. Our hometown gets about 17% of the funding comes from the federal government. And I want to say another thing that really bothers me. We hear from Musk and Doge, they want to cut efficiency. They want to make things more efficient. The most efficient healthcare delivery system we have are these community health centers. They do amazing work. The patients come in, they don't have to sit in an emergency room. They're quick, they're efficient. If you're a mom with 3 kids and one of them has 104 fever and a strep throat, you bring them here and they get treatment very quickly. You bring them to a hospital and they do great work. You can sit in the emergency room for hours and hours. So this bull that they're trying to cut efficiency, they're trying to make things more efficient and cut waste, is shown what bull it is by them cutting community health centers like Hometown, like Whitney Young, like the other CHCs that we have across America. And by the way, why are they doing this? Why are they cutting something as good and decent as this center? as good as Whitney Young, as good as Headwaters up there in the Adirondacks. Simple. They don't really care about helping people. They don't even really care about efficiency. They want to keep cutting dollar after dollar after dollar so they can give tax breaks to the very wealthy. That's the motivation. And that is Project 2025. That is Elon Musk, who says he wants to cut $2.5 trillion and not know even where. So this is the problem. Delayed and missed payments are everywhere in the CHCs. And I am here in Schenectady to say this cannot happen. We will not let this happen. We will fight until three things are done. First, all funding is restored, and there'll be no more cutoffs, intermittent cutoffs, day to day, week to week, month to month. Second, we need an explanation as to why they did it. What kind of reasoning? Because I'm sure they have no reason. But what's their explanation? But third, and a very real problem, is what we would call the community health centers funding cliff. The money for these centers expires on March 14th when the budget expires. In the budget in December, I worked very hard, and many of us did, bipartisan, to fully fund our community health centers for all of next year. And Trump and Musk came in and told the Republicans to cut it out. Even though we were in charge, we needed their votes, but you need 60, and they cut it out. So we now have a funding cliff. If we don't get that new funding by March 14th, these places could close. Whitney Young could close. Headwaters could close. And home health care could close across the state, and it would leave thousands. I hope we have the numbers here. How many people in, no, do we have the, in central New, oh yes, 110,000 people in the capital region depend on community health centers. 2.4 million people in New York depend on community health centers. If they don't renew the funding on March the 14th, 2.4 million people in New York will not have the health care they need. The efficient, effective, compassionate, caring health care that they get from community health centers. So the third thing we have to do is make sure, we hope our Republican colleagues will join us. We hope they won't succumb to the bullying of Donald Trump and Elon Musk, who only, as I said, want to cut everything so they can do more tax cuts to the wealthiest people. Hometown Health Clinic here gets $290,000 a month. That's $3.5 million a year. That's 17% of its budget. But it doesn't even mean they just cut 17%. When you lose that much of your budget, your systems don't operate. You don't know who to, you may have to lay off people. So it could hurt even more people than that. So this is something that is really, and it's happening across America. 5 centers already closed in Virginia because their portal was closed and they couldn't get their money. And we cannot let the fallout from Trump's funding freeze fiasco rip away health care from 110,000 citizens here in the capital region. That's about a tenth of the population, or the 2.4 million New Yorkers who depend on this. We're going to do everything we can to solve this problem and fight it tooth and nail. But it's a serious problem itself, but it also shows how phony this idea, we only want to cut wasteful spending. I'd like them to come here and tell us what the wasteful spending is. They won't find it. It's a very efficient place. I'd like them to go to Whitney Young in Albany and say what it is. I'd like to visit the Headwaters up in the Adirondacks. I visited these places. I know how effective they are. I know how efficient they are. So anyway, that is that. Now I'm going to call on Mr. Gambino from Hometown Health to say a few words. We're trying to make it quick because we're all cold.
This is a good time to be a proponent of short speeches.
Yes.
Well, first I'd like to thank Senator Charles Schumer for being here today. It's not often we get it. It's certainly not at Hometown Health. citizens of the health center and the media as well. I certainly appreciate you being here. This is hometown, as the senator said, provides a lot of care. Primary care, pharmacy, OBGYN, mental health services, help with addiction. We serve anyone. It doesn't matter who it is. You could be the richest person or the poorest person. If you need health care or another type of service, you can come to hometown. And when you think about it, at least the way I think about it, 17% of our budget does come from the federal government. But if you look about it and look at it and really think about it, this country needs a safety net. So I believe that the money that comes to our health center and other health centers across the country, as well as the ones right here in the capital region, is an appropriate use of taxpayer funding. If there is not a safety net in our country, what are we? We're not the United States as far as I'm concerned, because there are some people who are vulnerable, have issues that they need to have access to care, and that's why we're here. It's a program that's been in our country for many decades, and I hope it's one that's going to be with us decades long.
60s, from the 1960s.
It is. Look, if the senator said Donald Trump should come here, President Trump should come here, visit hometown, and see, our operation and how we serve the community, I invited him. That's a non-political statement. We, as health centers, try not to be political. We work with both sides of the aisle. But anytime we can get advocacy, we'll take it. That's for sure. But anyone from the administration is welcome to come here to see the good use of the dollars that we get every single year. And with that, I'd like to think that cooler heads will prevail, the money will continue to flow, and we'll continue to do the good work that we do every single day. And again, I want to thank Senator Schumer once again for visiting us here tonight.
Thank you, Mr. Gambino. Now, does everyone mind if we skip home and say a brief word, man? No?
There's 20,000 people that are served in this client base from Hometown Health. And it's part of the economic development that we've done here is to be able to integrate all that with the other hospitals. And it's just shocking that this thing is happening in Washington to hurt people who are just so vulnerable. And it sends the wrong message to not only Schenectady but other communities where you want to build things up, you want to be able to provide dignity and equity for people.
Thank you. And two other points. Gary and Mr. Gambino mentioned the hospital. Hospitals support CHCs. You'd say, oh, they're competitors. No. If you ask Albany Med, it makes their emergency rooms much more efficient. Because if you're a family, and as I said, a single mom, or even two parents working, and someone has strep, you bring them here, you get quick treatment. At the hospital, you sit in the emergency room, no fault of theirs, for a very long time. Second, it always has been bipartisan. In fact, the bill that passed in December that fully funded them was bipartisan, sponsored by Democrats and Republicans. It was only until Donald Trump and Elon Musk came in and told them, even though they weren't in office then, told the Republicans back off, that they did. We'll take questions on this subject.
Senator, are there ongoing negotiations with the White House to stop the funding cliff in March?
Well, the White House is so far sort of not said anything, but there is serious ongoing negotiations with our Republican colleagues who supported this in an effort to get them to resist Trump and Musk.
Senator,
Yes.
Is there any expected number of how many businesses or health care clinics are going to expect to be closed down because of this?
Well, if there's a funding cliff and we don't renew it, hundreds and hundreds will close down across America, and scores will close across New York.
Senator, both of your colleagues have supported this in the past.
Yes.
They still support this.
We're fighting like, we're first giving them the facts. I met with 20 healthcare CHCs, was it about 20? In Washington last week, many who are in Republican congressional districts here in New York, and they're contacting their congressmen. So we're going to do everything we can to get this done. Okay?
Senator, off topic.
We'll take one or two off topics.
As more federal employees across New York face uncertainty, work stoppage, and forced leave, what do you tell them and what can Democrats do?
Let me just say this in general. With these kinds of cuts and changes we've seen, we're fighting on 4 fronts to rectify, undo them, because they're outrageous. Just as I'm angry about what's happening here, I'm angry in many other ways. One is communicating to the public how bad this is and how it affects them. A lot of people don't know. People are busy. They don't follow what is exactly happening. But when the funding freeze occurred a week ago, I had over 50 organizations on the phone in New York. And I said, call your congressman, call your senator, and all of my colleagues, my Democratic colleagues, did this across the country. The calls came in and Trump backed off. They backed off and the funding freeze was rescinded. The trouble is that it's still intermittent. And we're still hearing it from different health centers. 5 in Virginia, I said. You asked how many were closed. Before this, 5 in Virginia closed because they got such trouble when the freeze occurred. Second, litigation. We are working with the attorneys general, including our attorney general here in New York and across the country, to go to court because this is illegal. It is illegal. They're not allowed to do this without congressional approval. And we're going to court, and as of Sunday, I don't know what's happened today, there were 46 cases filed, and we prevailed in 43. Now that doesn't mean the funding is all back. These were what's called TROs. They temporarily stopped what they were doing to go for a court case, but I'm optimistic we'll win a bunch of these. The third thing we're doing is oversight. So today, I established a whistleblower portal. And I put out a press release across America saying, if you're a federal worker, if you're working in one of these agencies and you see something really bad happening, call us and we will get to work on it. And we've gotten thousands of responses over the last while. And then we're going to have what's called shadow hearings. We're going to bring these whistleblowers to Washington, shadow hearings or spotlight hearings, we call them. It's because only, the Republicans won't do it, so we'll do it ourselves, okay? And finally, there's legislation, as I mentioned, on March 14th, we have legislation to fund the government, and we're going to fight very hard to get into that legislation to undo all of these bad things that are being done, including, of course, community health centers. Okay? Last one.
Yeah, Senator, today, New York lawmakers, they are expected to vote on a bill on special elections that could potentially delay Representative seats voting. Are you in support of delaying that special election?
You'll have to talk to the legislature about that.
But what message do you think that would send to voters?
Talk to the legislature and see what they're doing. Okay? Okay, thank you everybody.
Thanks.
Take care, everyone. Thank you. Sorry you had to stay out in the cold.
No, it's okay.
I gave you a little heat in my language.
Yes.
Thank you for the tape.
Absolutely.